Good morning. Today we will see about wedges and wedging techniques. Many of time prior separation of tooth is necessary to restore a proper contact. What will happen if there is no proper contact? It will result in a faulty restoration in the interproximal area which favors food lodgement resulting in periodontal diseases and secondary caries. So, tooth separation is much necessary during proximal restorations. There are generally two methods which is accomplished for tooth separation. They are slow separation and rapid or immediate separation. Coming to the rapid or immediate separation, it is the most frequently used method as it is quick and useful in clinical conditions. But it has some limitations such as it might rupture the periodontal ligament fibers and also there are chances that it might induce pain at the site. Coming to the rapid or immediate separation principles, they are based on two principles, that is, the wedging principle or traction principle. Coming to the wedging principle, it is accomplished by insertion of a pointed wedge-shaped device between the teeth in order to create a space at the contact area. The examples include the mechanical device that is the Elliott separator along with the wedges. Coming to the wedges, which are widely used and commonly used, is a preferred method for rapid tooth separation. It helps in rapid separation of the tooth and also prevents gingival overhanging of the restoration. It also provides a space which compensates for the thickness of the matrix band. It also helps in stabilization of the retainer and matrix during restorative procedure. It provides a close adaptability in cervical portions of the proximal restorations, thereby help in achieving a correct contour and shape at the cervical area. It helps in retracting and depressing the interproximal gingival area, thus minimizing the trauma to the soft tissues. It also helps in depressing the rubber dam in the interproximal area. So coming to the various types of wedges, the wooden wedges is the commonly used and the preferred one as it can be easily trimmed and can be fitted in the gingival embrasure. It also adapts well in the gingival embrasure. In addition, they absorb water which increases the interproximal retention. Moving on to the types of wooden wedges, there are available in two shapes, that is triangular and round. The triangular one is the most commonly used and it helps in stabilization and retraction of the gingiva. It is also used in tooth preparations with deep gingival margin. Coming to the round wedges, it is not so widely used but it is has a uniform shape. Usually, they are made from wooden toothpicks by trimming the apical portion. It is used in class 2 tooth preparation. Coming to the plastic wedges, it is a commercially available but they are not preferred compared to the wooden wedges because trimming is difficult and adaptability is difficult in these cases. The various types of plastic wedges are the normal wedges, which is similar in design to that of the wooden wedges. And coming to the wave-shaped wedges, they have a curved shape which helps in the easy placement and proper seal of the buccal and as well as the lingual embrasure without impinging the gingiva. And they are available in three different sizes and in three different colors. Coming to the white, which is small, and medium, that is pink, and large, which is violet. Moving on to the light transmitting wedges, they help in transmitting 90 to 95% of the incident light. It is mainly designed for the use in cervical area of class 2 composite restoration. It also helps in reducing the polymerization shrinkage because of light transmission. It also helps in the better adaptability. Moving on to the important points and the guidelines while placing the wedges. Actually, we should select the type and shape of wedges according to the requirement. The most common length of the wedges will be around 1 to 1.2 centimeter and it should not irritate tongue, cheek and the gingival tissue when it is placed. The wedge should be inserted beneath the contact area in the gingival embrasure. Usually, when it is inserted from the lingual embrasure area because it has a wider area compared to the buccal. Sometimes when it irritates tongue, it is inserted from the buccal area also. The wedge should be firm and stable during the restorative procedure, and it should not be forcibly inserted in the contact area, which might lead to pain and swelling. Moving on to the wedging techniques, the first one is wedging. Here, two wedges are used, where one wedge is inserted from the lingual embrasure area, while the other one is inserted between the wedge and the matrix at right angle to the first wedge. It is mostly indicated in the mesial aspect of maxillary first premolar because of the presence of fluids in the root near the gingival area. Moving on to the double wedging technique, here also two wedges are used, but one wedge is inserted from the buccal embrasure and the other one is from the lingual embrasure, and it is indicated when there is spacing between the adjacent teeth where a single wedge is not sufficient. It is also used in cases where there is widening of proximal box in the buccolingual dimension. Moving on to the piggyback wedging techniques, here also two wedges are used where one larger wedge is inserted as normally while the other smaller wedge is inserted above the larger one. They are indicated in cases where there is shallow proximal box with a gingival recession so that it provides a closer adaptation and contour to the matrix band. Thank you.